Поэтому удалось сделать эту работу. Вот сейчас Первана Валиева, я предоставляю ей слово. Она руководитель исполнительный директор этой организации. Она расскажет подробно о том, как был проведен этот проект. Перван Хам, прошу вас.
Спасибо, Хагат Кадирова. Thank you very much for this opportunity, dear Asker and colleagues from Stop TV Partnership. Good day from Azerbaijan. I am Parvana Valieva, Executive Director of Sağlama Hizmet Public Union. It's a civil society organization. And I feel proud. I am a TBEC board member, TB Europe Coalition. Today I will present to you about civil society experience to support TB case finding in Azerbaijan with FDR XR portable X-ray device, which equipped with artificial intelligence. It deployed in Azerbaijan, and this activity supported by Stop TB Partnership and Fujifilm. The screening activity was implemented in collaboration with NTP and Tabib. For your information, Tabib is a health authority in Azerbaijan, which is responsible for administration and management of health facilities. There are already explained the specification of device on this webinar, but I can tell you that this device is very compact, easy to carry. This is a new era, I think, in radiology. It has low dose of radiation. It is assistant to the doctor. No need for indoors. You can use it on open air. No need for dark places on like traditional X-rays. No need for electricity. You can shoot 100 images with its charged battery. And the device, the equipment read the image you shot, applying to large capacity of data. This is the first time this state-of-art equipment is being deployed for TB screening in Azerbaijan, and I think in AK region. It is designed to provide a quick analysis in hard-to-reach areas, regardless of internet connection. Its problems, as globally, TB case notification rate also decreased in our country as a result of lockdown, stay-at-home measures, restriction of public transport, fear of COVID-19 infection. Hospital visits reduced during the pandemic, and as well as some health facilities either reverted into or TB personnel involved in the fight against coronavirus. And the lack of digital technology and shortage of easy to carry health products in our country led to weakening of active case finding during pandemic. And they challenged provision of essential TB services in our country. Next slide, please. This is an image of mobile van. We call it a Flora mobile machine. It is very big in size and weighs with tons, not suitable to offer services at home, at communities. And we had only mobile vans in the country, but now we changed the minds. And Minister of Health, Minister of Justice, other health institutions plan to procure several such portable X-ray devices to ease TB detection in the country with the means of technology. Next slide, please. This is how the process done within seconds. The image shot with a main unit of X-ray is converted via Devo 2 monitor to Console Advanced. Console Advanced is, in fact, it is notebook, but it has a software. We just click on one button on Console Advanced, and it's so-called system Rayleigh, which is AI, read the image, and it gives scores, abnormality score and TB score. Accuracy and sensitivity are very good. The entire system with main product weigh only 6 kilo. AI solution detects 10 different radiologic findings on chest X-rays, including atelectasis, for example, fibrosis, nodule, pleural effusion, pneumothorax, calcification, consolidation, cardiomegaly, and including TB, tuberculosis. It provides like a heat map, probability score, whether each abnormality is present or absent, whether TB is likely present or absent, and specification of the location of each abnormality. Next slide, please. Here I would like to demonstrate you a video how it is super compact. This is X-rays suitcase, including in the set. And this suitcase has separate slots for each part of device. That is fast packing and unpacking of the equipment. It is ultra light, can be carried in any kind of car, vehicle. The set also included 2 tripods, one for main unit and one for Devo 2. But you can shoot without tripods as well in your hand. Devo and main unit have on power banks to charge them, and I can say that we never feel to charge them during the activities. We charge them beforehand and down the screen in any places we selected, whether there is electricity or not. Yes, this is easy to carry. Next slide, please. So how we get this health product, X-ray, why it was important, why they supported us. In November 22, previous year, we applied Stop TB partnership about the problems occurred in the provision of essential TB services during the pandemic in our country. In fact, we asked Stop TB to support us with portable GenExpert or other easy-to-carry diagnostic health equipment to support the strengthening of TB detection in the country. So they told us about experience of other countries with portable X-ray systems, machines. We decided to organize a joint webinar with Stop TB, Fujifilm, and the Pasi Foundation from Pakistan, which organization is the first in the globe deployed this device for TB screening. And after many correspondences, calls, Fujifilm prepared a support structure for Azerbaijan staff, thanks to Morita-san, Jijen, and other colleagues from Fujifilm. We achieved to sign a free of charge rental agreement with Fujifilm Turkey, one of the distributors, to obtain the device for 6 months. Next slide, please. Yes, and they supported us not only with the device, but also training, maintenance, warranty of the device, and also as there is not any such kind of device in our country, we import the device to the country. They supported us on logistic issues as well. We organized one promotional event and one training that was conducted specialists from Fujifilm Turkey. And we have future plans and sustainability. After 6 months, we should return this device to the provider, but we plan to procure this device with support of the Japanese embassy in 2022. The screening project that we suggested will be funded by the Global Fund within CRM projects, COVID-19 response mechanism. We plan to cover entire country. And after we finish our project with this device, we will hand over this equipment to Research Institute of Lung Diseases, the NTP. to meet the needs of the people who apply to a public hospital, public health facility. Yeah, this activity, as Hagigat Hanım said, the activity organized and implemented in collaboration with National TB Program, Research Institute of Lung Diseases, TABIB, local health facilities, local executive powers, and State Refugee IDP Committee. We conducted screening activity in 4 different refugee camps. In our country, refugees are more vulnerable. They are mainly overcrowded, living compact, mainly malnutrition and unemployment problems accompany there. And we screened in their community. We come their places. We go their places and we screened 385 people. Now it is till date, it is more than 400, and we now deliver services, screen our patients, which are mainly ex-prisoners. And we plan to screen labor migrants, vulnerable migrants who live under UNHCR care. We plan contact tracing. We plan to screen people living with HIV, people with diabetes, diabetes, and people who has chronic lung diseases and TB history. And the activity continue with the help of NTP, the bacteriological confirmation of the presumptive cases confirmed by NTP. This is the video how we organize the screening activity as a community and civil society organization. During the screening, we are enthusiastic to share more information about TB among the people for awareness. We distribute brochures, booklets. We demonstrate educational movies, audio files with loudspeakers, and even we round by our car to announce the place, the event details, place, time, and etc. with our microphone. The process begins to distribute numbers among the patients to have more comfortable working atmosphere and not facing any house. People who approach to our registration desk first answer some questions. This is questionnaire screening. Then we invite them to take the chest X-ray. The shot is done within seconds, and the AI reads the result within 30 seconds, 20-30 seconds. The radiologists and doctors from NTP also read the image, and diagnose is mainly the same with AI. AI draws circles on the location where the abnormality detected and give it scores. If any presumptive TB case detected, the patient enrolled to other specialists from NTP to give sputum sample. The sample stores in one cool box, then carried out to a reference laboratory right after the campaign finishes. That's it. Thank you very much. And we collected the data in Excel database for any surveys. In the end of my slides, I would express my personal view with some sentences, if you don't mind. This kind of work, collaboration with doctors, assisting NTP in case finding, also improve capacity of civil society organizations, develop communities, increase their knowledge on TB care. Civil society organization, as you know, plays an integral part in TB response. Indeed, it is obvious that we can't achieve the UNHLM targets without interventions and contributions of communities. So let's join our efforts and NTB together. Thank you.
Спасибо большое, Перван Хам, за интересную презентацию. Я хочу только добавить к тому, что как национальная туберкулезная программа и Институт легочных заболеваний, который